Text: Sexual Abuse Resident and Family Council Discussion Guide. Maya's story.
Hi, Mom.
In phone video, an elderly woman lies speechless as she flicks her tongue and licks her lips.
Hi, Mom. How are you feeling today?
My mother was born in Jakarta, Indonesia in 1931.
Photos of women from her teens through adulthood.
She remained there until 1942, ended up in various parts of Europe for a number of years. From there, she built a wonderful life here in the United States. We moved her into initially kind of a senior living apartment building, so there wasn't any assistance, but she was fine there for a while.
Woman holds her toddler daughter on a swing set glider. Maya Fisher, advocate, daughter of victim.
And then we noticed it was time that we probably needed to move her into a facility that had a little bit more help for elderly folks. On December 18th, 2014, I had gone to work, as I normally would. I usually get to work around 6:30, and I just happened to be walking to my office, and I checked my cell phone and saw that I missed a phone call from the nursing home. They had tried to call me at 5:30 in the morning, and I'd missed that call. And so I called them back. You know, the first thought I had was, this isn't good. Why is a nursing home calling me at 5:30 in the morning? And because my mother had been in the nursing home for so many years, my first thought was that she passed. But when I called them back, I was connected immediately to a nurse who had told me that my mother had been sexually assaulted.
In a reenactment, a doctor takes notes at Maya's mother's bedside after the assault.
You know, one thing that was horrible in the emergency room was watching her hooked up to an IV, and her Alzheimer's was far enough in progression that she couldn't swallow very well, so they couldn't give her any oral medication. So that was heartbreaking, watching her be stuck with pins and needles because, you know, at 83 years old, they wanted to make sure she didn't get a sexually transmitted disease.
In phone video, Maya's mother is pointing and tapping on her groin as she lies in bed.
And after this event, we noticed that she was banging quite a bit on her private parts, trying to tell us something with, you know, tears rolling down her eyes. And the heartbreaking thing was that though she couldn't move a lot, I had seen that motion before. But it wasn't until we knew what had happened to her and that we knew that she had been raped that I kind of put two and two together and realized she could very well have been trying to tell me this for months. And so to have assured her that she'd been safe, that she'd be safe, only to have her raped.
Maya blinks back tears as she opens her hands, a photograph of a teen, Maya and her mother, in front of a bookcase.
How do you ever forgive yourself as a child? That you made that promise that she'd be safe and she wasn't.
Maya's mother with a wiry-haired dog.
And my mom was always a very dignified woman and you know, such a wonderful, beautiful soul.
A toddler Maya sits in her mother's lap in a photo with her parents.
And this event just stole any dignity she had left. It's just so inconceivable that somebody would do this to an 83-year-old woman who can't speak and can barely move.
Maya, with pursed lips and teary eyes, shrugs.
It's just not something you ever expect.
Text: Sexual abuse, identify it. Tara Paddock, Supervising Prosecutor.
It is a crime for a caregiver, staff person, or anyone employed in a care facility to engage in sexual contact or penetration with a resident in the facility.
Lynn Gerard, Registered Nurse, Director of Quality Improvement, Education, and Risk Management, Guardian Angels Senior Services.
The sexual abuser preys on the individual that can't say something, that can't call attention to the fact that they've been abused. So we look for soft signs of abuse.
Dr. John Brose, Associated Clinic of Psychology, founder, CEO, clinical pathologist, 2020 Minnesota Gerontologist of the Year, Minneapolis, Minnesota.
Soft signs of abuse is any time that you see a resident changing from how they were behaving before. Pay attention to why are they doing it that way. We do this with our pets. We do this with our children. They maybe can't put words to it. We go, something's wrong.
A caregiver holds a wheelchair as a man reads a book. A caregiver holds a woman's arm as she takes steps with a walker. Caregiver holds a hand of a bedridden man. Caregiver taking a man's blood pressure and making notes. Lynn Gerard, registered nurse.
We're also looking for staff who are territorial maybe with a resident. They volunteer to always care for that resident. They volunteer to care for that resident behind a closed door. And maybe they're in there for an excessive period of time. Is there a specific caregiver that continually wants to provide care? And then are they making choices for timing or interventions that are different than the normal for that resident?
Tara Patton, supervising prosecutor, domestic violence, crimes against persons unit, St. Paul City Attorney's Office.
A particular case that comes to mind is where a caregiver was leaving the wing that he was assigned to and going to another wing of the facility and providing shaving services for this male victim in the middle of the night. That was a red flag to other people in the facility, and ultimately he was caught as someone who was sexually abusing that patient.
Lynn Gerard, registered nurse.
For instance, if a staff member comes out of a room and they're adjusting their clothing, they're tying their pants, they're buttoning their shirt, any of those kind of things are clues that something has happened that shouldn't have happened.
Dr. John Brose, clinical pathologist.
There's all kinds of boundary violations that can occur. It can be standing too close to somebody. It could be flirting. It could be using endearing names to a resident, calling somebody honey, that sort of thing. It can be bringing in gifts.
Lynn Gerard.
Maybe there are interactions that we see with a staff member or a resident where they're always together, or maybe they always have an arm draped around them, or maybe they're always complimenting them on how they look, on their clothing. We need to be aware that those are indicators that maybe there's an unhealthy relationship there, and that unhealthy relationship could be a sexual abuse relationship.
Text, sexual abuse reported. Cheryl Hennon, Minnesota Office of Ombudsman for Long-Term Care.
The Vulnerable Adult Act of Minnesota includes provisions that state if you are employed by a licensed provider, you are a mandated reporter. A mandated reporter must report any suspected abuse, neglect, or exploitation. It's the law. And there are penalties, possible criminal charges that can be brought against someone who had the responsibility to report but did not report.
Khalees Smith, advocate, SOS Sexual Violence Services, St. Paul, Ramsey County Public Health.
We start by believing victims, and it's up to law enforcement or whoever to do the investigation to say it's not true or that it didn't happen. But our role as advocates is always to believe victims.
Cheryl Hennon.
Do not assume that if you do not report, someone else will do the reporting, because someone else must have seen that happen.
Lynn Gerard, registered nurse.
I would rather that I investigate 99 times and find out nothing happened than to miss that report where something really happened.
Cheryl Hennon.
Housekeeping may see something that doesn't look right. It doesn't matter where you are on the hierarchy, if you will, of a long-term care facility as an employee. If you see it, report it.
Ellen Johnson, BA, RA, Sexual Assault Nurse Examiner, SANE, A, CEN, SANE Program Supervisor, Regions Hospital.
Don't think that you have to prove something is wrong. You just have to have a suspicion. And then you follow up on your suspicion. That is going to provide safety for the patient as well as the institution.
Sergeant Chad Turcott, Pequot Lakes Police Department.
So if you really believe in caring about them, it's in your best interest to report that. It goes hand in hand. If you care about them, you want to report it so in that way they are protected. And that's our main goal.
Example of the Minnesota Adult Abuse Reporting Center, MAARC, mandated reporter form.
By doing the MARC report, notifying law enforcement, you are protecting them.
Text, sexual abuse, stop it. Lynn Gerard, registered nurse. Text, avoid the silent culture.
If your employees are fearful of communicating information to you, if they have fear of their fellow staff members, that they can't report something for fear they'll be retaliated against, if they have fear of the management staff not believing them, if they're silent about the needs of the resident, there can be an undercurrent of abuse.
Josh Hagum, attorney, MSBA, board certified labor and employment law specialist, Pemberton Law.
The culture of silence also is created because sometimes, let's say it's a resident, they don't necessarily believe that anybody's going to do anything about it, or they're afraid that they won't be believed. Address the culture of silence by empowering employees, first of all, to feel comfortable reporting to people who can get something done about situations.
Dr. John Brose, clinical pathologist. Evening images of a care facility. A care worker is seen through a window preparing a bed.
If you can operate every day, I am the guardian, I am the voice, I am the eyes and the ears for all of the 100 residents in my building. If every staff took that motto and lived it every day, we would have much fewer instances of abuse, neglect, or sexual exploitation.
Credits. Special thanks to Maya Fisher, Lynn Gerard, Dr. John Brose, Tara Patet, Khalees Smith, Cheryl Hennon, Josh Hagum, Ellen Johnson, Sergeant Chad Turcott. Sponsored by the Minnesota Office of Ombudsman for Long-Term Care, Minnesota Nursing Facility Rates and Policy Division. Copyright 2021, State of Minnesota, Department of Human Services. This video was produced using civil money penalty, CMP, funds. Permission to use, copy, or distribute this video is hereby granted, provided the video is not edited or altered, and the above copyright notice appears in all copies. Produced by Minnesota Department of Human Services, Nursing Facility Rates and Policy, NFRP, Division, and Minnesota Office of Ombudsman for Long-Term Care. P.O. Box 64973, St. Paul, Minnesota 551640973, 651-431-2000. Toll-free TTY 800-627-3529. Videophone 651-964-1514. Website https://mn.gov/news-initiatives-reports-workgroups/nursing-homes/civil-monetary-penalty.jsp. Copyright 2021, State of Minnesota, Department of Human Services. This video was produced using civil money penalty, CMP, funds. Permission to use, copy, or distribute this video is hereby granted, provided the video is not edited or altered, and the above copyright notice appears in all copies.